According to a McKinsey report, there are more than 2.1 billion people on this earth who are either overweight or obese. This number accounts for 30% of global population. The NHS states that around 1 in every 4 adults and around 1 in every 5 children aged 10 to 11 are either overweight or obese. Estimates of the direct NHS costs of treating overweight and obesity and related morbidity in England have ranged from 479.3 million in 1998 to 4.2 billion in 2007. Estimates of the indirect costs arising from the impact of obesity on the wider economy, such as loss of productivity, has ranged between 2.6 billion and 15.8 billion. There's a prediction that indirect costs could be as much as 27 billion by 2015. For most of you who are watching this, I think the first cause of obesity that comes up in your head is that this person must have eaten too much. In fact, there's other factors such as sleeping time is also relevant to the cause of obesity. We spent billions of pounds treating obesity and we just made it worse. The graph below shows a continuous increase in obesity with hardly sign of improvement apart from 2008 and 2009. However, people don't seem to be happy staying fit. We want to break this task down into two parts, preventing obesity and tackling obesity. Under this background, we also focus on different groups, for example, different ages. We have babies, children, and adults.
The cost of government spending is very big on obesity. However, by finding more information from Quito, we find that the effectiveness is relatively low. Most of the people are neutral about the subsidy. From the whole week research, we find that government is mainly subsidized on healthy food or healthy meals, but the subsidy in the beginning is very big. So most of the time, government didn't spend enough, so not all the people can access to affordable healthy meals. From this point, Philips can make others aware of their product, can make healthy meals much cheaper, such like the air fryer, especially used in school, hospitals, and company canteens. From Philips' annual report, we can see the revenue mainly comes from the health tech and lighting. In 2014, 18.3% of the earnings before interest, taxes, and amortization are health tech and consumer lifestyle, and 6.1% comes from the lighting part. And Philips' current strategy is to split its company into lighting and health tech, so we are going to focus on these two parts in our later presenting.
An existing product in Philips' healthcare division is the PureWave ultrasound transducer. It has overcome the difficulties of producing high-quality scan image for diagnosis of obese patients. For obese patients who are going for weight loss surgery, the ultrasound transducer also has its uses. Before the surgery, a full body scan is carried out to spot if there's any health conditions that will complicate the surgery. And after surgery, it is used for checkup. There's a new technology called laser lipolysis. It uses similar technology as 3D ultrasound scan of babies in pregnant women, but with a much higher frequency of ultrasound rays. How it works is that, firstly, the ultrasound rays penetrate the fat layer causing vibration, which turns the hard fat into liquid. After that, the body's lymphatic system carries the fat through the digestive system, which is then naturally excreted. The fat cells are inactivated by the laser beam, so it claims that the fat is permanently removed from the cells from the body. The advantage of this method is that it can target a specific body part, and it is easy for the patient to recover from the treatment. However, currently it is only used as a cosmetic treatment, so whether it is effective enough to be a medical device is still unknown.
Nutrition in infancy can influence the later health and development of child. Studies showed that infant behavior such as sleeping, crying, and feeding can affect obesity. Actions such as extra food before bedtime or using food to soothe non-hungry child digest can cause obesity excessively. From the graph, we can see that the intervention for both sleeping and feeding can reduce the obesity most. So, in order to prevent obesity, parental education will be important. Government can provide the program about obesity that spread the knowledge about nutrition and feeding style. Philips also has a range of products for mother and child care, and Philips can have promotion on and development on such products such as breastfeeding products or other related products. Also, there is a problem for dealing with infant obesity, which is it is very difficult to recognize overweight infants, so it is recommended to promote growth monitor and early screening to identify infants who may be at risk based on early growth. This can be a new direction for Philips to innovate.
As looking through the public information website, we have found that government subsidize or give free compulsory school meals and improve healthy quality. And also for hospital and companies, they have intervened the meals provided. Some of the hospitals have a non-sugary drink policy in cafeteria, vending machines, and patient meals. Also, they have reduced the price and the portion size. However, the results of the healthy meals are not that good. From the quick analysis, we can see more than 60% of the people are neutral about the importance of healthy meals. For example, some schools are dropping out from the healthy meal plans. This is due to the students are too young to be rational. They continue to have existing options instead of healthy ones. And also most of the people responsible for achieving this balance are volunteers who aren't trained in nutrition or food distortion. This is very interesting information for our company, because the best way to solve this problem is letting things be easier. Philips can introduce their air fryer to school canteens to cook no oil and low-calorie food. It can produce tasty fried food with at least 80% less fat. And from the chart, we can see that most of the people are happy to use air fryer and this series of machines. So the market is ready for us to encourage more people to have the low-calorie food made by our air fryer.
And another intervention can be weight management programs. Some personal technology can support health monitoring easily, such as goal setting, tracking, and measuring of key behavior and health outcomes. As for Philips, the product called ActiveWatch, which can record your heart rate, respiration, sleep, and light exposure data. Then you can collect this data by using USB. And the Apple Watch can also used for health and fitness. Also, it has much more functions, such as sending a message, location, and using other apps. Another similar product is a smartwatch by Google, and it can share the data on cloud platform. So actually, Philips can develop their existing products to have more functions, such as upload the data to cloud platform so that people can have a better plan for their obesity, and these products can be used for both prevention and tackling obesity. And there are many these kinds of products. The typical one is the wearable watch. From the quicker result, we can see that there are many companies have this product.
Philips Lighting Division's current product, the Wake Up Light, changes the color and intensity of the light half an hour before we get up. It wakes our body clock up before we actually get out of bed. Since it's proven to be effective, it demonstrates how artificial lighting can affect the human body. This leads to a new research area, the LED light therapy. Many studies have suggested that different colors of light affect human brains differently. For example, the blue and purple colors suppress appetite, while red and yellow stimulate it. It is also found out that dimmer light encourages eating more. Therefore, we can try to prevent overeating by using different colored LED lights. Circadian rhythm is found to be important in weight control as it affects certain hormone production. For example, melatonin, which is a sleep hormone, encourages weight loss by increasing beige and brown fat, which are the good fat that burns energy rather than storing it. By taking sunlight during daytime hours, circadian rhythm can be strengthened. Philips has a wearable blue LED light therapy device called Blue Control to treat skin diseases, and it can develop it further to treat obesity just like the red light lipolysis treatment. It is a device owned by a healthcare technology company called Extreme Pulse. It uses infrared light generated by an LED to break the bonds between fat, which utilizes fat as fuel when you exercise. Currently, it's only used as cosmetic treatment, but it might become an application for obese patients.